has been said to be a very, very busy but productive day of the week. And that is why we have fixed such rich webinar to this day where we are in the right spirit for productivity. We are at the right state to learn, to relearn, and to unlearn. Without wasting much time, I'll be bringing our speaker on soon because we tend to keep this webinar concise but very, very rich and informative. We are aware, especially those in Nigeria, West Africa, we are aware of the current reemergence of some veterinary public health diseases, zoonotic diseases to be precise, especially in West Nigeria, Oyo State to be precise, where in about 6 months we recorded, you know, over 5 deaths from rabies through dog bites. It is a concern to the veterinary body that when we are looking towards eradicating diseases like that by 2030, we are still having fresh cases in 2025, just 5 years to go. So it is expedient that we don't fold our arms to uh, this issue. We ensure that not just rabies, but every other possible emerging and reimagined diseases are well thought through. We are aware of what they are. Secondly, we know how to handle them. Thirdly, we know how to prevent them and we know how to control them. And we have, enough knowledge of them that we can educate awareness, which is, I'm sure, is a very cogent part of public health diseases or issues. So that I don't take too much of your time, I will just move, you know, to the business of the day. So please, just to have your data and to be able to reach out to you, specifically sending you the slide of our speaker for today, kindly introduce yourself in the chat box, your name and your location, probably your email. And we expect that everybody here is a vet or at most a veterinary student. This webinar is strictly for veterinarians. Thank you very, very much. I'll be reading the citation of our speaker now. Dr. Adisa David Oluwaseun is a veterinarian with over 15 years post-graduation experience as a private practicing veterinarian who is passionate about veterinary public health and preventive medicine over the years. He graduated from the prestigious University of Ibadan, with a degree of Doctor of Veterinary Medicine. He bagged Masters in Veterinary Public Health in 2014, and he is a consultant and fellow of the College of Veterinary Surgeons of Nigeria, FCVSN, Veterinary Public Health Specialty. Dr. Adisa David Oluwaseun is married and blessed with beautiful children. Our speaker is rich in all areas, professionally, career-wise, and family-wise. Please join me as I welcome our speaker for today, Dr. Adisa David Oluwaseun. Welcome, sir. We are so glad and grateful that you are doing this with us. So in summary, so you have till 8:50, so we can take questions and contributions. Thank you very, very much, sir.
Thank you very, thank you very much. Let me salute every one of us in this webinar this evening. It's a privilege for me to be here, and I'm so delighted. As been introduced by our co-host, I'm Adisa David by name, a veterinarian, and I'm a veterinary public health expert. So once again, I want to welcome every one of us. I believe I'm audible enough.
Yes, sir. We can hear you clearly. Very, very audible, sir.
Okay. So we kind of make this discussion tonight a kind of interactive because we are all veterinarian, and by virtue of having DVM, and we are to just rub minds together. I know we might have various departments or maybe sections. Some might be small animal practitioner, some might be in medicine, some might be in surgery, but all together we are veterinarian. So the topic we are discussing this evening, let me have the slide, please. It's taken from the public health aspect point of view. Imagine and reimagine disease of veterinary public health. Imagine and reimagine disease of veterinary public health. I believe this should not be a new topic to us as veterinarians. We all know what are imagined diseases and what are reimagined diseases. From what the host has discussed with us, in recent time, we've been seeing various cases coming up, those that have been in existence in time past, and some that are just coming up newly, as a result of mutation and some pattern of forming. But we as veterinarians, we need to be prepared as part of emergency preparedness for us to be at the forefront, because when we talk about all these diseases, in a way, it affects both human, animal, and even the environment. So it forms the tripod. So we as veterinarians, we need to take the bull by the horn by addressing all these problems so that the society at large will be free and safe. So going by the definition, what do we understand by, okay, let me just quickly go through the outline. Sorry, I'm not an academic person. I'm a field person and as well a private veterinarian, but at least it's quite important for us to know what we are to discuss. Just make it a kind of easy slide so that we will not be bored. The outline for tonight's discussion: introduction to imagine and reimagine diseases. Then, what are the examples of emerging diseases and what are the examples of reimagined diseases? What are the factors contributing to emerging and reimagined diseases? Then that will lead us to the impacts on veterinary public health. Then as well, we discuss the preventive and control measure. Then we conclude, and after which we entertain some questions so that we can rub minds and gain from one another. So going by the virtue of introduction, what are emerging and reimagined diseases? Emerging and reimagined diseases are infectious diseases that have recently appeared. They are recently appeared, they've emerged or have been consistently present with an increasing in incidence and geographic range. When you see that the number of the cases keep multiplying, so we talk about being reimagined. So what are emerging diseases? These are diseases that are newly identified or previously unknown and are becoming prominent in our environment. Like I said, we have so much of these diseases, and some that we have seen in time past, and they are still coming back, reimagined because of mutation, and some have some kind of physiologic form. So, and statistically, it has been shown that 75% of emerging diseases, animal diseases, are zoonotic, coming out from the public health point of view. When we are saying that 75% out of 100 of emerging diseases that we have in this present dispensation, in this era, in our environment, are zoonotic, that shows that they can easily be transmitted from animal to human being. Like I said earlier on, that the environment is made up of the animal itself, the host, and the environment. So I just quickly cited, we have so many examples of emerging diseases, so that for us to know the extent of what our discussion will be basically on. Examples of emerging diseases. I know we are familiar with avian influenza. That is majorly in poultry. Then we have zoonotic tuberculosis. Research has shown that in this era, human being we can trace the TB from the human being from animals. Zoonotic tuberculosis. Then we have African swine fever. That's majorly for pigs. Then we have bovine spongiform encephalopathy, BSC. We can as well call mad cow disease. Then we have Nipah disease virus, antivirus, rabies, then foot and mouth disease, FMD, Zika virus, and we have leptospirosis. I just pick some of these examples of emerging diseases, but we are going to basically discuss just two, which I think, based on what I've seen and with the experience I've seen in recent time, I just pick bovine spongiform encephalopathy and avian influenza. Then later on, we talk about rabies due to the case of the incident of such diseases. So, bovine spongiform encephalopathy, you agree with me that is a viral infection, and the synonyms, it can as well being called a mad cow disease, BSC. Then basically is the type is from the prawn. Prawn etiology is from prawn protein, no nucleic acid, and we will be obliged to talk about the pathogenesis of the infection. And when we're talking about that, we discussed about the infection required via injection, and the prawn isolated initially in pairs patches of small intestine, and the movement of lymphocyte takes the prawn to the predilection sites, such as the tonsillar material, spleen, and thymus. And permit me to say that in some sphere of the country which have opportuned, some of them that normally do importation, from meat inspection, it has been saying that because of BSC, they've decided to remove the spinal cord of such animals, so that at least it will be sure that they are free from that particular diseases. Then you talk about the replication of the prawn in the site is followed by the propagation of the prawn up the nerves to the spinal cord, and eventually the brain. The typical incubation period for this is between 2 to 8 years before the onset symptoms, which progress over the month. Then there are the clinical signs that normally see from the animals. They will be so aggressive, there will be nervousness and lack of coordination. Then, if you are opportune to do some gross lesion, maybe under the, you may normally not see anything on the microscope, but within the brain tissue, then to be sure, from the public health point of view, such animal with this particular disease is considered to be unfit for human consumption. So that is for BSC. Then quickly to talk about avian influenza. You know, we have so many types of avian influenza, depending on the ones that the animals that have been affected. You know, we have the H5N1 and the H7N9 strain, which are particularly concerned due to their potential to cause serious health issues, you know, both in birds and in human. Then AI, being normally called bird flu, is a viral infection that affects birds, but can also affect human beings as well and other animals. It's caused by the influenza A virus, which has several subtypes, a part of which I've mentioned, H5N1 and H7N9 strain. Then, this particular avian influenza, what are the impacts on livestock? You talk about high mortality, then there will be economic loss. Then transmission and spread is through direct contact as well. You can also have impact on human health, which can be characterized as from human infection, severe diseases, pandemic risk, which may be with high mortality, and so on. So next slide, please. So now, talking about what reimagine, we've discussed about the emerging diseases. I'm trying to just give us the overview of some of the diseases that are grouped under emerging disease. So talking about reimagine, they have been around for a long time, but are resurfacing, often due to increased incidents. Like I said, when the pattern of the incident rate began to increase. Maybe, for example, we've recorded 1 or 2 cases before, and now it has increased to 2 or 3 or 4 more cases. So you can say that that particular disease is reimagined. Increased incidents, changes in pathologic behavior, public health lapses, which can be as a result of ineffective vaccination program, or changes in human policy or reduced public health awareness. This can lead to an outbreak. You know, thank God for such a webinar we are discussing, just for us to have a kind of rubbing minds together to discuss, create awareness about these reimagined diseases. And examples of these reimagined diseases, from this table, I just picked some. We have rabies, we have bovine tuberculosis. You can see that now we still have avian influenza, foot and mouth disease, brucellosis, leptospirosis, tick-borne diseases. Example is Lyme disease, that do affect human being, anaplasmosis, African swine fever, then Zika virus. Then, for the sake of this reimagined disease, we just talk about 3 of it. Then I'll talk about the TB resurgence, then brucellosis, then rabies. Like I said, that TB is very much around us now in this present dispensation, because it cannot be far-fetched, because it's not only from human to human. Now, the origin has been from animal origin. That's why we say when you get some meat and meat products that are not fit and safe for human consumption, that has this nodular lesion. You know, when you go for inspection, you inspect TB lesions. They are not supposed to be taken, and the nodular lesions you find there are the ones that causes this problem. And when you incise either from the liver or from the lungs or from check the lymph node to really check which of the animals are fit and free of these particular diseases. Then the brucellosis, that one can be seen in animals as well. And when unpasteurized milk were taken from injection through the milk or milk products, human being can as well contact that particular disease. And it has shown that this disease do normally cause what we call abortion, even in humans as well. Research has shown that. And the rabies, which is very much more around us. You know, yeah, we've seen cases of dog being bitten because of these dogs. They have not been vaccinated or protected from rabies, and that will lead us to the next slide, please. So, what are the factors contributing to emerging and reimagining diseases? We have so many factors. Part of what we have been discussing, all these diseases, you know, they are from new pathogens, either virus or bacteria or parasite, depending on which one they come from. Then we talk about vaccination efforts and challenges. That is particular to rabies. You know, so many of our dog owners, they've not been, their dogs have not been well vaccinated. And some, even the dog breeders, even don't really know what rabies is all about. People in the village. So there is need for us to let them know that with our dogs, because dog is the best companion to human being, need to be vaccinated so as to safeguard this particular disease. Then another factor is environmental changes, climate change, urbanization, people moving from one point to the other. You know, when we had issue of COVID-19 at that time, it was Ebola. It was related to movement of some people from one part of the country to the other. So our borders need to be well guided so as to prevent all these emerging of these diseases. The environmental factors, weather, climatic change, all those are contributing factors to emerging of diseases. The globalization, increased travel or trade. I made mention of TB the other time, that if from a particular country, if they see that the animals there are not free from TB, those cattle or those meat products will not be allowed to be exported. You know, for trade, you know, we need people exporting their meat and products, their cattle outside the country, need to make sure that all these animals are free from BSE and also from TB, because those are zoonotic diseases. The increased human and animal interaction. Talk about the Lyme disease that I said that it do affect a human being. So when we have animals and human beings interacting together, there should be a guide to safeguard all these diseases from being taken from animal to human being. Then the one that covers it all is antimicrobial resistance, AMR. Thank God that work has been going on, research has been going on about this. The way we use drugs, misuse of drugs has been a contributing factor. You can see that some people will have loaded their animals with a lot of antibiotics, and these animals will still be brought to the table for human beings to consume. And you now see that when human being come down from any of these ailments, a drug being used will not be effective because of the misuse of these drugs on the animals, which the humans are now consuming. Then what are the impacts on veterinary public health? Both imagined and reimagined diseases pose significant threats, not only to animal health, but also to human health, as many of them are zoonotic. I've said that earlier on. The majority of these imagined and reimagined diseases are zoonotic. They are transmissible from animal to human being. So that shows that as human populace, we need to guide ourselves, to protect ourselves, so that not to fall victim of all these diseases. Next slide. So impact on veterinary public health. Economic consequence for farmers and industry. When the animals have come down with diseases and they are dying, there will be problem. Animals that are meant to boost the GDP of a country, and you can see peradventure, if it is AI, if influenza that has affect or wipe away the stock, it will become a problem for farmers and for the industry. Then there will be threat to food security. BSE, bovine spongiform encephalopathy, when they say that those animals are not fit to be imported out of the country, and to be eaten as well, because the disease can as well affect human being if they consume such meat. Risk to human health through zoonotic transmission. We are all prone and exposed to this kind of problem. Then public health threats, even the environment will be at risk. Biodiversity loss, threat to wildlife population, because there are some of these diseases that their etiology, their reservoirs has been likened to be from the wildlife. So there will be a problem. Importance in veterinary public health. Understanding this disease are crucial for developing effective surveillance, prevention, and control strategy in veterinary public health. So there is need for us to have a good surveillance, routine testing, monitoring of cattle for either BSE or any of these diseases should be a standard practice in many countries, even our country, Nigeria, as well. And also, a part of the preventive measure should be that our feed ban, the laws we are making to make sure that animal byproducts in cattle feed are prevented from all these diseases we are talking about. Next slide. So that takes us to the prevention and control measure. I've talked about the surveillance, vaccination strategy, biosecurity practice in farms, public awareness campaign, then one health approach. And when we talk about the biosecurity, if we are saying that we are facing is a poultry farm, maybe AI, for example, there should be a stringent biosecurity measure, such as controlling the access to farm, disinfecting the equipment, isolating sick beds, making sure that you prevent the spread of the virus among the farm. If peradventure there is an outbreak of AI in a farm, there is need for us to contain the disease within that farm settlement, so that other farms, nearby farms, will not have access, and the disease will not be transferred to other farms. Then, if it is AI, for example, there are standard pattern talking about calling the animal, the birds stamping out, so that we will be sure that disease does not leave that environment. Then there is need for us to do public awareness. Part of what we are discussing this webinar, it may be through jingle or whatever. The federal government is also doing such, to making sure that people are well informed about it. Then the One Health approach, the veterinarians, human medic, and even the people from the environment should also come together. It's supposed to be an holistic approach, so that we all of us will collaborate to achieve that particular purpose of making sure that our environment is free from diseases. Then surveillance and monitoring. The importance of surveillance system. Surveillance needs to be put in place to monitor the trend at which the disease is moving, and roles of veterinarians in monitoring diseases. As a veterinarian, we have so much roles to play, because even more than our human counterparts, because we should be the one at the forefront, because all these animals, we understand, we know the diseases, we can easily judge and know what the problem is, and we can address such problem. Then case studies of effective surveillance program. Avian influenza zoonotic, which is characterized as, we have low pathogenic avian influenza and high pathogenic avian influenza type A. Then part of it we need it for us to know how to coordinate ourselves to achieve that particular purpose. Next slide. Then, in conclusion, animal disease can have a devastating impact on animal production, trade in livestock and livestock production, food security, livelihood, and consequently on the overall process of economic and social development. It is important that proactive measures are put in place for effective and efficient veterinary public health. Through all these things, we'll be able to safeguard and curb any diseases that might come or that might affect our environment at large. I think that's all. Thank you for listening. If there's any questions, like I said, that we are just to rub minds together. It's an holistic approach. Thank you very much.
Wow, thank you so much, sir, for that very rich section. I have lots of questions already, and it's a good thing that we even have more time. I thought we would just have 10 minutes for questions, but as it is now, we have more time for questions. Thank you so much, sir. So we are going to be welcoming questions. Just raise your hand, and would permit uh, would permit you to. Thank you. Yes. I will permit you to speak. So just raise your hand and that's it. So anybody wants to ask a question? If you have anyone, you can just raise your hand. You might not be able to unmute yourself. All right. For me, my first question is that what are the factors, that actually trigger we having emerging diseases? And what are the factors that trigger re-emerging diseases? What is it that we have a lot of theories we see online that in a particular country they just go to the lab when the world is peaceful and they just they just cook up a virus and they just release it into the air. How do emerging diseases come about? Then even the ones that we have been able to control, what are the factors that make them come back again during emerging diseases?
Okay, thank you very much. Like I said, am I audible?
Yes, sir, you are.
Yeah, like I said earlier on, that emerging diseases are new or newly identified diseases that are increasing in incidence and geographic range. And like I said, that several factors can contribute to emerging diseases. One of it is environmental changes. I made mention of environmental changes. This era that we have, urbanization, people are moving from one place to the other. And before all these diseases, they are far, 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 far away from us. But because of the urbanization, we are now the one moving close. You see that the villages are becoming town now. So those are the things that can bring us close to all these diseases. And the climate change as well can be a contributing factor. When there is changes in weather, all this can also contribute to us having these diseases in our midst. Then globalization, people traveling from like the Ebola we talked about, it was as a result of people moving from the place that the person came from to the country. But thank God that we have system in place to really make sure we curtail such disease before spreading. So, because majority of them are zoonotic, it can be from animal to human being. All those things are like a contributing factor to it.
All right, sir. Thank you, sir. My second question is, are all emerging and re-emerging diseases infectious? Or, we have a separate category of infectious diseases? Or can we say that all emerging and re-emerging diseases are infectious?
Yeah, we can categorize them as being infectious. When I group the emerging diseases, there are some that we see that appear in emerging and also under re-emerging. They are coming up again. Are you getting it? So we can basically say that they are infectious.